Hey guys, it's Dr. Justin Marcagiani here. Today's video is going to be on acid blocking medication while taking hydrochloric acid. All right, we're going to dive in. We're going to talk about the medication, how to work the HCl out, and kind of next steps. Before we dive in, smash that like button. Give me a thumbs up. Really appreciate it. Subscribe, hit that bell so you get notifications, and put your comments down below. Are you on an acid blocker? Are you taking any hydrochloric acid? What's your experience? All right, so first off, let's dive in. If you're on an acid blocker, the question is, do you have an active ulcer or active stomach irritation? Generally speaking, anytime my patients are on some kind of an acid blocker, we lean in with enzymes first. We don't want to add any more acid to the environment, even though they may need it. We have to understand if the situation is an acute issue, inflammation, gastritis, ulcer. If it's acute, we do not want to do anything to add more acidity. We want to work on calming and soothing. And then typically, if they're on an acid blocker, symptoms are getting better and or stable, we're trying to work on getting to the root underlying issue. So the first thing is going to be just getting the inflammatory foods out, getting them on a really good healthy paleo template to start, and leaning into good chewing habits, not hydrating a lot with food, and taking more enzymes. That's going to be like our first good step. Now, as you start to taper off the acid blocking medication, if symptoms do not get worse, that's a good step. Let your doctor know, make sure they're in the loop. Again, you got to make sure you're making changes. So if you were eating a lot of irritating foods and you didn't pull those foods out and then you started dropping the acid blocking medication, that may cause you to relapse. So as long as we're making root cause changes, let your prescribing doctor know, then you can do it, but be responsible. So we always lean in with enzymes, good chewing, right? 32 chews per swallow, right? 1 chew per tooth on average. In general, make sure your food's like an oatmeal-like consistency. Maybe have less raw food, right? More steamed, more sauteed, really cooked up well. So think of cooking as pre-digestion. And then if you're on an acid blocker, you can start just by dropping that dose down. Let your prescribing doctor know. You can just kind of start off by decreasing in 25% increments. It's totally fine. Your prescriber may have a good idea of how to do it. The key is make sure you're getting to the root cause of why that acid is there. If you have an active ulcer, you may not want to touch it. All right, so it just depends. You want to make sure you're working with a doctor. You don't want this video to substitute for medical advice. You really want to make sure you're dialing it in. Lean into enzymes. Now, if there's no active issues and you can gently drop down the acid, that's a good sign. Lean more into the enzymes. And then if you can gently drop down the acid medication with your MD's approval, that's great. As that gets off, as you start dropping off the acid blocking medication, then you have no negative symptoms, you can start leaning in with a little bit of ACV, maybe a teaspoon 5 or 10 minutes before a meal. If you do good with that, you can progress to a tablespoon, which is 3 teaspoons. If you do good with that, you can start adding in a quarter or half a tablet of HCl and then continue to taper up there. So it just depends. Some people are on acid blocking medications chronically, but they have no active issues. Some are on it because they have acute inflammation, gastritis, ulceration. If it's acute, don't do it. If it's chronic, you can start to fix the underlying issues, lean into it, and work on it. There could be other underlying issues that are going to fully prevent healing. That could be H. pylori. It could be some kind of SIBO or bacterial overgrowth or fungal overgrowth. These could be affecting the situation. Now, you have to get those addressed. So you want to think about getting a high-quality stool test done so you can assess what's happening there. I'll put the link for the one that I recommend, the GI map. That's going to be a really good genetic stool test that's going to look deeper and will be more sensitive for picking up infections. A lot of people think, well, why would you want to add acid when you already have irritation? Well, because a lot of irritation in the gut is because of not enough acid. So what happens is you take in food, there's a low stomach acid environment, the food rots, it putrefies, it ferments, it creates its own acids, thus creating irritation and burning, right? So a lot of times adding in some acid can decrease or it can help the breakdown process. Remember, acid helps make the environment harder for microbes to grow. It also activates proteolytic enzymes. Pepsinogen to pepsin really gets the digestive system going. It also gets the dominoes moving so you can make more bile and make more proteolytic enzymes when that chyme or mixed up food goes into the small intestine. So the first thing is get off the acid blocking medications the right way, MD's approval. Make sure you're dropping it slowly. Lean in with enzymes, lean in with good diet changes, lean in with more chewing food. Take hydration away. Once the medication's dropped, you can lean in with a little bit of acid, lemon juice, apple cider vinegar. Start with a teaspoon, go up to a tablespoon if you're good. Then we can always start to lean into a quarter, a half, a full tablet of HCl, usually around 600 to 700 milligrams a tablet. Now, I recommend usually usually getting people on my GI Restore when there's any gut irritation. The GI Restore is going to have high levels of zinc, glutamine, DGL, aloe. It's going to have vitamin U from okra, a lot of good healing nutrients that are going to be very helpful at calming down the gut lining, help to build back that gut lining as well. So if there's any irritation, we'll add in more bone broth, more collagen. We'll add in the GI Restore, usually 1 to 2 tablespoons in the morning, mixed in some water. That really will start setting the table and healing up the gut lining. And then from there, we can start to, disengage from the acid blocking medication appropriately and responsibly, lean in with enzymes, and then we can gently start adding in some acid from apple cider vinegar, lemon juice. And then as we progress that's kind of our challenge. If we're good, then we can make sure we go on to the HCl tablets. Again, if you have any active ulcers, don't do it. If you're spitting up any blood or any blood in your stool, definitely don't do it. So just make sure you're doing it responsible. This kind of gives you a good outline, but make sure you're working with your medical doctor and or your functional medicine doctor on this too. All right, hope that helps. Get to the root cause. Make sure you test your gut for H. pylori, SIBO, bacterial overgrowth, or other infections that could be keeping the gut inflamed. Let's see if we have any questions here today. This is a live chat, so we'll dive in. My friend gets a crazy cough, got better when she took a dose of Nexium. Didn't want to take it, but cough was crazy. Should we start with enzymes? So let me see here. Cough got better when he took Nexium. Yeah, so it just depends, right? I mean, anything can cause anything. So you need a pattern. I always tell patients, like, one-off things aren't very helpful. You have to test it on, off a couple of times because things can sometimes happen at random. So you have to know if that's the case. Either way, alkalizing the gut's not going to fix anything long-term, so you really want to lean in with better digestive support. And again, if their diet's crap, then everything's up in the air. So diet has to be good. If not, you're not testing from a solid foundation. With H. pylori, will HCl cause it to go deeper in the gut lining and then harder to treat? I don't think so. I mean, the H. pylori will always make compounds that help neutralize the stomach acid. H. pylori is already barred into the gut lining anyway, so you're going to have to treat it and knock it out. The problem with the H. pylori, it's going to make your digestion suck, so you're going to have less enzymes, less acidity. You're not going to break down your food. You may have less bile, and then you're going to have a harder time digesting food. So the first thing is make sure you digest food, but you got to make sure you have a plan of attack to get that addressed too. What's your take on the increases in cases in hot climate numbers? Oh yeah, so this is the C word. So in general, cases are going up, deaths are like this. So it's just more testing like this, cases of this. In Austin, I can tell you, going to the Travis County Public Health website, you're gonna see symptomatic cases are actually dropping. What does that mean? That means more asymptomatic. More asymptomatic, what does that mean with demographic? That means younger population. If more people of a younger population are getting the C word, what does that mean for mortality rate? It's dropping, right? So if you go look at any bell curve for the C word in Europe, it's parabolic, up and then right back down. Every country has done the same so far, so there will be no reason to suspect that here it won't be the same. So just an uptick in testing, and people are going to get it if they've been inside for a bit. It's going to happen, and we just have to work through it because the asymptomatic rate is so high. People just have to get through this thing, and if you're really in rough shape, stay inside, or at least really keep that social distancing thing going. How do you feel about flaxseed milk? Any non-dairy milk would you recommend? Yeah, I would do coconut milk because it's a better quality fat. It's less fragile than the omega-3s that are plant-based, the linoleic or linolenic acid that's going to be plant-based. So I would not recommend that one, but I would do more of a coconut, more of a stable fat. What if we're still chronically bloated even in the fasted state? What does that mean? Depends. It depends what kind of diet you've done. Have you done an autoimmune low FODMAP diet? Have you done an elemental diet? It just depends upon what kind of things you've done. And if none of those things have relieved it, it just tells me more than likely there's SIBO or some kind of other chronic infection and you need to work with a practitioner. What if we're chronically bloated? Yep, I think I answered that question. Yeah, good. I think I answered all those questions. So in general, with acid, we need enzymes. Our stomach's very, very pH driven. We need acidity to trigger our gallbladder to work. We need our acidity to trigger our enzymes to work. If they don't work, we're not going to digest and break down our foods. And if we don't get enough good zinc and sodium and chloride, we're not even going to be able to make good hydrochloric acid. So we need to really make sure we're absorbing our nutrients. Very important. How do you know if you have sufficient stomach acid? Well, a good thing is if you don't have digestive issues, that's probably a good sign that you have enough stomach acid. You're going to see bloating, you're going to see motility issues, you'll see digestive issues. Any kind of chronic digestive issue, my opinion, you can just assume that there's not enough stomach acid, because I see increasing stomach acid tend to be a strong palliative needle mover in those symptoms improving. So that's always a good first step. And we know as you get older, stomach acid does drop. If you look at Dr. Jonathan Wright's book, Why You Need Stomach Acid, he talks all about that in the book. And then, of course, I always use enzymes and acids separately, partly because if people are sensitive or have irritation in the gut, we may only be able to do this much HCl, but we may be able to ramp up a lot more enzymes. So if you're doing a combo product, well, if your HCl is here, now you're stuck here with your enzymes, right? But if you do them separately, your HCl is here, but you can ratchet up the enzymes instead. How can a prolonged fast help with a mass polyps? Polyps typically are going to be from inflammation and insulin resistance. So you really got to work on fixing the diet and the root cause. Again, most people with polyps, they're going to go in for the colonoscopy. They just get it snipped, right? But never fixes the root cause of inflammation or typical insulin resistance that drives the polyps to begin with. What does never-ending toilet paper situation mean in terms of digestion? It means you're not breaking down your fat adequately. Fat in the stool tends to be really tough in regards to wiping, a lot of wipes, or you see smearing on the toilet seat. That's because of the fat. So more enzymes, more acids, and definitely more bile salt. If your stools look more blonde or clay-colored or floating, then that's definitely a sign that you're not absorbing fat. On the GI map test, we'll look at steatocrit, which looks at maldigested or not digested fat in the stool, and that can be a good indication of what's also happening as well. Great question on that one. Yeah, typically I say you want to be done for your number 2. You want to be done for your BMs in 3 wipes or less. That's a pretty good rule of thumb. If you're taking more than 3 wipes, there's probably, a situation where you did too much MCT oil in your coffee or something, or maybe you need a little bit more digestive support. Maybe the meal was a little too big. Those are pretty good rules of thumb. And then always take an eye on how your stool looks. Is it floating or not? Those are other good indications as well. All right, guys, hope you have a phenomenal weekend coming up. It's a holiday weekend. Hope you enjoy. Take a look at this video. Pass it around for family or friends who have it. And again, utilize the advice in here with a grain of salt with your functional medicine doctor as well as your conventional medical doctor. This is Dr. J signing off. Hope you guys have a phenomenal day. Take care, y'all. Bye.